The central pharmacy in Misrata was bombed in the first few days. So first, we sent medical supplies, and then we sent medical teams to help the Libyan doctors who were working round the clock.
At the end of April, overwhelmed by the number of wounded, an MSF team was sent to provide support in 2 of Misrata's hospitals. The doctors arrived by boat from Malta and, despite the security risks, are treating medical and surgical emergencies, trauma cases, as well as reoperating on patients wounded earlier in the conflict. Today, the rebels are in control of most of the town, but attacks continue. Outside the city, closer to the front line, staff working at advanced medical posts stabilise patients before referring them to Misrata's hospitals.
Retirer maladie ça, c'est l'hygiène propre. Si nous pas faire l'hygiène propre, choléra spectacle manger nous.
In Haiti, back in November 2010, hundreds of cholera patients poured into the treatment centres. After several critical months, the number of cases decreased, but it was just a lull. At the beginning of May, the number of cases surged again in Port-au-Prince.
Last week, at the beginning of June, for example, we received 1,800 cholera cases in 3 days in the MSF Port-au-Prince facilities alone. That's a lot, and we only have 800 beds, so we could not treat all the cases.
Right now, in mid-June, Port-au-Prince is the only area medical teams are worried about. They've increased their treatment capacity in the city. The situation in the rest of the country is stable, but it could degenerate quickly. Doctors remember when the first cases appeared 8 months ago. The cholera vibrio spread across the country within days. Hundreds of thousands of people lost their homes in the tsunami. Initially housed in overcrowded evacuation centres, they are now gradually being relodged in temporary shelters. The families may have a little more intimacy, but they are more isolated.
If you see Manami Sanriku, the whole town is destroyed, and so every sort of business opportunity is gone. So for people, what the future is going to hold, where they're going to get their money from, is a big issue. There's worry about their children. The children have returned back to schools now, but families are worried about how they are coping, how the experience will affect them in the long term, how they're playing.
For survivors, the future can be more daunting than the tsunami itself. For Médecins Sans Frontières, psychological care is a priority. Teams are working in 2 prefectures in the northeast. The target has been set. According to the United Nations, 15 million people must be put on treatment by 2015. The figure was set in June by state leaders who attended the summit in New York. To reach this goal requires a strong financial commitment, a financial commitment that is difficult to secure.
Nowadays, several countries who are worst affected by the HIV epidemic would like to bring better treatment to more people, and unfortunately they are prevented to do so because of the lack of international funding. We are halfway now, and I don't understand why suddenly the political commitment is not there anymore.
Yet the results are encouraging. Recent studies show that starting treatment earlier reduces the risk of transmission of the virus by more than 90%. The widespread use of treatment could mean an end to the epidemic. It will be impossible, however, to reach the target set without funding, without scientific innovation and without political support.
Je vais donc maintenant mettre aux voix la motion de rejet préalable. Qui est pour? Qui est contre? La motion de rejet préalable n'est pas adoptée.
Until this year, foreigners presenting a serious health condition were able to obtain a temporary right of residence if treatment was inaccessible in their home country. Under the new law, this has changed.
Before, the patient had to have access to treatment in his home country. Under the new law, treatment simply has to exist in the country. Yet we are fully aware that in many countries there are inequalities in distribution and in access to healthcare. The fact that treatment exists in the country does not mean he or she will have access to it. Basically, patient access to healthcare has been reduced.
Sick foreigners represent less than 1% of foreigners living in France. This law will encourage them to live illegally in France, which will mean they stop their treatment, which in turn will present an increased public health risk.